Tonight, we debrief with a Houston ER doctor to learn about the current rise in COVID hospitalizations and what she's seeing on the front lines.
This year has really been one of the most difficult years. I spent some time in the U.S. Army for 10 years prior to Baylor St. Luke's, and it has been probably the toughest of my career.
With over a decade working in medicine, Dr. Gina Blocker has been on the front lines of emergency room COVID care since the pandemic began.
The patients now are younger, healthier. The symptoms are more subtle, nasal congestion, symptoms analogous to allergies and other common cold symptoms.
If their symptoms are so subtle, how are they ending up in front of you?
Patients don't have established primary care doctors. A lot of them that come in the emergency department do not have outside established care. People are coming just for symptomatic care. They're tired of their nose being stuffy, they have a headache, general malaise, they want to feel better. And a lot of them are coming for COVID tests as well.
So talk about the conversations you're having about vaccines with the people who are coming in and have COVID.
Sure. The first question I ask them is if they're vaccinated. Most young people that I've been diagnosing with COVID, and I ask if they're vaccinated prior to sharing the results with them, state that they're not vaccinated. I ask their opinion about the vaccine prior to giving them the results of their COVID test.
What are their reasons for not getting a vaccine?
They don't have a reason. They don't have a reason.
It's at that point that Dr. Blocker delivers the news that those often young, healthy individuals are COVID positive. And she says many break into tears and many immediately ask for a vaccine.
A lot of them are unsure where to get it. They're scared about, whether it's going to change their DNA, the way their hair grows, or, I've heard so many different reasons. And, it's then teaching about what the vaccine is, how it works, and why it's still important to obtain a vaccine. And I ask patients to wait at least 60 days prior to getting it with their positive COVID test at that time. Most patients are willing to listen and hear me out at that point. I find it very difficult at the time of diagnosis to then discuss the COVID vaccine.
Why?
It's a point of contention as a caretaker, because we have so many things that can be prevented with this vaccine: severity of illness, infectivity. This virus isn't going anywhere, and we have to do the best we can as a community to prevent the spread of this Delta variant.
To her point about some people not being familiar with where they can get a vaccine, they are widely available now through your city or county or at stores like H-E-B, Walmart, Kroger, Target, CVS, Walgreens. Just visit any of their websites for locations and hours of vaccine availability and whether you need an appointment or not. All COVID vaccines are free. Some people think that you might need insurance. You do not. It is all taxpayer funded. So you don't need any money. You just need to book an appointment, or in some cases walk in, and your shot should only take maybe 20 minutes. You just have to stay for the 15-minute wait period after. You can learn more on the COVID-19 section of fox26houston.com. But Dr. Blocker says one issue that needs to be addressed going forward is why so many people do not have a relationship with a primary care doctor, and how to increase trust and access to everyday health care so we don't see so much mistrust and misunderstanding in an emergency.